Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
Welcome to another edition of the Business of America. And I say this all the time, and the audience knows, every show is a treat, but today really is a treat. I'm sitting with someone who is so important to the policy ecosystem of patient groups and health policy in Washington, D.C., and she's a small business owner. She is one of the doers in the arena, Teddy Roosevelt's man in the arena. Well, we're talking to a woman in the arena today, someone who decided not to stay on the sidelines and just criticize, but someone who decided, let me get in, let me roll my sleeves up and get some things done. It's been an adventure. We'll talk about it. But my guest today is Janet McUlsky, the founder, the CEO, the president, the center of McUlsky Health Force. By the way, and I've said this before, even with other guests, the greatest name of health policy, public affairs firms in D.C. But Janet, welcome. Thank you so much.
Thank you, Jerry. I'm really happy to be here.
So I got to ask you, it's your anniversary. Tell us about the anniversary. Tell us a little bit about yourself and the anniversary of McUlsky Health Force, please.
Thank you. And thank you for those who are listening. McUlsky Health Force was founded 5 years ago as I retired from Pfizer after 20 years there, 5 years with Pharma before that. So a good tenure of 25 plus years working for the pharmaceutical industry. But unfortunately, as I retired in May, it was literally when COVID was shutting the world down.
So before you go on, so I'm anticipating here that you started a business when everyone else was either being forced to close businesses or cut back, or remember those, you go into a small shop and they can only have two people in at a time.
Yes.
So when business was struggling, that's when you decided to start a business. I'm sorry, but go ahead.
Well, and to be fair, yes, that's a fact.
Yes.
But truth be told, as I retired from Pfizer, the vaccine teams at Pfizer, as everybody knows, were desperately trying to find the vaccines that would be, opening the world back up. Right. And so the vaccine team, who I'd worked with for years, called me and said, we need you to not retire and to work with us. And so how can you say no? My husband and I had planned to go traveling the world, which wasn't going to happen. And so we thought, let's do what we need to do. And so that's what we did. We, one of my dear friends that had worked with me for years at Pfizer and Pharma, actually, Nona Bear, and I said, let's do it. I mean, she was there since day one working with me.
I have to tell the audience this, and a special shout out to Nona. I've known Nona for 20 years, and she has been, yes, she's an advocate for patients, and yes, she knows her business in terms of advocating for patients and for better access to healthcare. She's all that. She's also one of the most kind, gracious women I've ever met. In fact, my kids refer to Nona as our DC grandma. So anyway.
Well, no, I think I can understand, because Nona and I had worked together for a long time. So she and I said, let's do it. I mean, we have to do it. There's just huge needs in the Washington space, because not only were we all at home locked in our houses, and Nona and I both have family stories. My daughter didn't do graduation or prom or any of that. Her freshman year in college was not what it should have been, but we all felt like we really needed to help people understand what was happening with development of vaccines, so that they had a level of comfort. And President Trump was all the way behind it.
Operation Warp Speed.
Yep.
Eric Hargan at the HHS, he was an assistant secretary or deputy secretary. I think that was his baby at HHS, Operation Warp Speed. We don't talk about Warp Speed much, but again, just for our audience, so you know this, it takes, Janet, roughly a decade for a medicine to get to market.
Yes.
And it's what, between $1 and $3 billion?
Yes.
We'll talk about
Yes.
that. But with Operation Warp Speed, it was 10 months or around 10 months from development to market. Yes and no.
Yes and no. And the reason I say no is the companies had been working on mRNA technology for years. Yep. And that's what people like who get very goosey about it and worried will say, how did you do it that fast? And it's because the research had been ongoing for mRNA vaccines, with the idea being that you could pivot much more quickly when a vaccine, because what happens with so many of these viruses and everything, that goes around there is that they mutate, and then you have to change the vaccine. We see that with flu. Yeah. We see that with COVID.
I was just saying, right. Just in the news this last week, there's a new strain, news out of China and other parts of the world coming to America that COVID is. Right. We're not done with COVID yet.
No, I think that's right. So, and not to belabor it, but that's really what pulled us to say we can't just relax and go home and travel or do whatever. So we decided that we would do this, and one thing kind of led to another. We started with Nona and I. We now have 15 employees.
Wow. 5 years, 15 employees.
Right.
You hear the argument or the truism that 5 years. If you can make it 5 years, pretty good chance you've made it. I know that you're still striving, working, moving forward. Tell us a little bit about the work that McUlsky Health Force does, and then I want to get into some of how you're innovative in this space. We're in Washington, D.C., or if you're in New York or Chicago, L.A., public affairs firms, advocacy firms. There are many of this sort. But what you do is unique, extraordinarily unique. In fact, I want to say it might be the only such firm in our town that is not just working with clients, but advocating for patient organizations and access to care, and at the same time trying to speak truth in a public discussion where there's lots of rumor and gossip and untruths and politics and everything else. It's a difficult position, a difficult job to do, but 5 years you've done it. So tell us a little bit about what McUlsky does.
Okay.
Can you do it? Is it possible?
It's possible. Our clients are pharmaceutical companies, but what I think makes us really distinct is there are also a lot of the nonprofits. Because we feel like they need to have their voices. The CEO of Pfizer at one point had said to me, anything you're doing that helps build the voice and the credibility of and I don't mean just patient groups, I mean consumer groups, I mean rural healthcare, the National Grange, I mean, all those groups that are striving to speak on behalf of patients. As I was thinking about this today, it goes back somewhat to the AIDS community that really begin to speak out.
Patient organizations. The patients themselves, actually, even before maybe there were organizations, patients getting involved and speaking some kind of truth, some kind of reason into a political debate.
Right.
Yeah.
And so what we tried to do was, from well before even McUlsky Health Force, was to help them learn how to speak and on their behalf, and to really help people hear them. I think about the time we did one of the breakfasts that we used to host at the Willard. We had Mike McCurry, who, if you remember, was President Clinton's press secretary.
Yes.
At the time of some of that charming stuff that was going on at the White House. But we had Mike, who was actually in seminary at the time. I don't know if you knew that.
I did not.
Mike went to seminary, and I asked him to come and speak about how nonprofits can work with the media more effectively, because they weren't. They were afraid of the media. They were reluctant to speak to them because they were afraid that something bad would happen to them if they talked. And so we had Mike come in and do an hour-long presentation of how do you talk to the media? How do you get your voices out so that they begin to hear more and see more of what you're trying to say on behalf of patients? So we do a lot of work with the nonprofit community.
That's still an issue, by the way. A lot of nonprofit groups are very leery about talking to the media, and I guess in our age now, it's years later, and Mike's still around. I know he's still around. I see him every so often, but it's now social media. It's now there's media has exploded in terms of Substack and blogs, and so you still have your traditional media, but it's grown. And again, McUlsky still helping patient organizations deal with new media. I know that phrase has been used before, but I'll say, but new media also, right?
Yep. The other thing I would say, we've spent a lot of time trying to think about how do we get a better understanding built on the ecosystem of drug development.
And this is a controversial issue, and I don't think much of what we talk about today, folks, let me apologize in advance. Every so often I throw a little something provocative out there, but I do think drug development, how does a medicine get to market, the right medicine, the right time, the right cost, the right patient, we don't talk enough about it, because when pharma talks about it, well, of course pharma is saying this because it's in their economic best interest. And we like to beat up on big pharma. They're a perfect, everyone does. It used to be, I'm from, my parents are up in New Jersey. Our senators, regardless, Democrat, Republican, they were Democrats. This was our home talent. The pharma industry was Jersey. That has changed. Pharma, the industry, the pharmaceutical industry, is beat up by everyone these days. So anyway,
no, I was just going to say, I think a lot of it is miscommunication, a lack of communication. I remember doing an event up at a research facility for my former employer where we brought in...
Was it in New Jersey?
No. Groton, Connecticut.
All right. That's Greater Jersey.
Yeah, there you go. Where we brought in a bunch of the mental health community and talked about what is it that you want with new medicines? How do you want them developed? What are the side effects that you want dealt with? And we had the scientists in the room, and they were astounded to hear from actual individual patients not to be totally rude here, but they were less concerned about weight gain. They were more concerned about sexual dysfunction as a result of their medications.
Yes,
and so you could see the scientists in the room as open their eyes widened as they begin to understand what patients really wanted and needed.
Sometimes we think of, and again, I have great respect, admiration for those in the medical field, but I recently suffered through some health issues, and I really grew a new appreciation for the techs and the nurses and the aides, because I wasn't just a patient. I wasn't just check him off and make sure he has this and this. And God bless doctors, but I got a lot of that. But it was the aides. It was those around who made me feel like a person, you know. And I think that with science, sometimes you're so concerned about the science, we forget that the science is for what? It's to make the lives of people better.
Yes.
Extend their lives, save their lives. I even think those who criticize pharma, and pharma deserves some criticism. Everyone does. Billy Tozen said, and by the way, for our audience, just a full disclosure, I also worked at Pharma many years ago. Not with Janet, though. We missed each other.
Younger than I am.
I'm not sure if that's true, but Billy Tozen, who was the CEO of Pharma at the time, former congressman, Democrat turned Republican from Louisiana, he said that if you want to stop being accused of doing bad things, stop doing bad things. So there is this self-awareness. But that being said, it's the golden goose or the goose that's laying the golden eggs of new cures, new therapies, and talk about bios and biosims, and we're blessed to live in this time of innovation.
Very much so.
Yeah.
I mean, you look at something like lupus, which, an enormous number of people suffer from lupus. And until, I'm guessing 5-6 years ago, there had not been a new drug for lupus that had been approved since FDR was president.
Oh, my goodness.
They had buttons made because they said,
was there even an FDA during in the Roosevelt years?
No, but now there's 3 new ones that have been, in the last 5-6 years. So,
which is such a good point, Janet, because we hear a lot about all they're doing is taking the medicine, making a slight change, and it's
Me Too.
It's the Me Too, and I'm sure there are Me Too medicines.
Yes,
but there are a lot of new medicines, and we haven't even gotten to where we're going yet. Yeah. When I was at Pharma, there were some old timers there, some men and women who had been there for when Pharma was predominantly concerned about cosmetics.
Yes.
Before, people don't remember this, or I don't remember it either. But before the big blockbuster medicines of the 90s,
Lipitor.
a lot of the pharmaceutical companies their profits were made in cosmetics and other. And this very wise man told me, he said, if we're not careful, public policy-wise, if we're not able to develop the allies and the friends who can help us, we'll just go back to making hairspray or makeup or whatever. And I thought, wow, no, I want the new cures. I want.
So do you know how Pfizer actually started in pharmaceuticals?
Tell me.
So Pfizer, during World War II, when penicillin was first invented, not by Pfizer, but they needed huge quantities of it because there were a lot of people, I was going to say men, and largely men, dying of not the wounds that they suffered, but the infections that were the result of it. So the United States was trying to figure out, how do we manufacture massive quantities of this new miracle drug that had been developed by a scientist in his laboratory.
Right.
And they went to a chemical company, which was Pfizer out of Brooklyn, and said, can we repurpose your facilities and your knowledge to be able to manufacture large amounts of this? So, in some ways, whether it's cosmetics or other chemicals, most of them, that's where they were.
Yeah.
And it was only a little bit by happenstance that, that they ended up getting into the pharmaceutical world and really. But the other thing that I think people need to understand is the whole ecosystem of drug development is critical. You've got to have the patient groups talking about what they need. You need to have the NIH talking about the very basic levels of their science development.
Sure.
And then you need the pharmaceutical companies to take that basic research, put it into clinical trials, put it into, the whole 3D model.
And then, of course, you need the FDA.
Right.
To have the resources and the experts for the approval process. A lot of our friends on the right criticize regulation, stifles innovation. Okay, but to my friends on the right, well, that means we're going to have to invest public resources into FDA. Right. And FDA is very innovative because there's PDUFA, which is user fees that the companies pay for the drug approval process and that sort of thing. But it is worthwhile, and I say this to my friends. I'll just tell a quick story, pardon me.
Please.
But back in the early 2000s, 2003, I was at Pharma when the Medicare Modernization Act was being fought, the battles in, again, Can we think today that Medicare never had a drug benefit? That's insane to me. Who would develop an insurance without a drug?
But when you look at where the drugs that were available at the time, they weren't what they are now.
That's true.
So it made sense then. Yeah. It just didn't make sense anymore.
But anyway, I went to my friends at the Heritage Foundation. Heritage is nearby where we're filming today, and they were dead set against it. And I was like, I don't understand.
Right.
It's a public good. I mean, healthcare. George Washington understood. We like Washington in this building, right? Talking to at Heritage, and he understood it was a public good. That's why he put health officers at the ports. You know who the breakthrough was on the right to get support from conservative groups for the MMA, and it was Grace Marie Turner.
I knew you were going to say her name.
And,
Rest in peace.
Yeah, Grace Marie. We lost Grace Marie
Last week.
just recently, and again, one of the most gracious, wonderful women in the world, advocates. She was the founder and the president of the Galen Institute. So Grace Marie Turner, our hearts go out to her family, and may she rest in peace. But she was a pioneer.
Yes.
In terms of no, this is a good, and Grace Marie was right. The spending wasn't what the contrarian said it would be. It wouldn't work. It did work. It has worked. It's one of the most popular government. I'm doing this government because it's a private public partnership.
Yes.
Medicare Part D. It worked. So things in this town can work.
And they can change. As they need to over time. So that's what we, as when we said, when Medicare started, it might not have made sense. But then years later, you had to put a drug benefit into the system. So, I do think that's what we talk a lot about these days is also the complexity of the healthcare system. And it's
systems, right? Because there's TRICARE, Veterans Care, Medicare, Medicaid, private insurance, and then we have, of course, the pharmacy benefit managers and the middlemen, and we have insurance companies, and oh my goodness, it's all kinds of public-private systems and subsystems and everything else. But I'm sorry.
No, I think that's absolutely right. And to help people understand, it's one of the things that the patient groups do a lot of is trying to help people navigate through the system. I myself, a couple of years ago, enrolled in Medicare. It's not easy. And I'm just no, it's not.
Honestly, I was going for a walk the other day because I walk now. I'm trying to lose weight. And I thought I did the years when I have to, I'm like, and it made me nervous.
Yes.
Anyway, but I'm sorry.
No,
it's complicated. It is complicated.
It is complicated. And I have to say, very recently, I was trying to get some medications for my husband, and they told me my copay was $400 and some odd for eye drops.
Oh, my goodness.
Eye drops. And I said, but
were these special eye drops?
Yeah. Well, no. And I said,
gold. These are golden eye drops.
But he's reached the $2,000.
Oh, what? Yes.
Cap.
Yep.
And they said, I hate to say this, it was an insurance company, and they said, "What are you talking about? What $2,000 cap?" I'm not kidding you. This was within the last 2 weeks. It just talks about the complexity of all of it.
But also, I want to ask a couple questions, or we can talk a little bit about the insurance industry, because we don't talk enough about insurance and their impact, both negative and positive.
Yes.
But a lot of negative on the healthcare ecosystem of these systems. I was talking to a mutual friend of ours, Dr. Langer, Andrew Langer's wife, who is a physician.
Yes.
25 years in the military, retired a colonel. So this is a serious woman. She's a physician. And she tells me stories of when she's about to engage in a procedure with a patient, and she gets, stop, insurance company won't cover it. And she has to get, go.
Scrambling
and,
to try to
talk. And what she tells me, or the story she told me just recently is, then you're not talking to a physician on the other side. You're talking to some
bean counter.
Yes, who doesn't even understand what's going on. And so this is a problem in our healthcare where you have health insurance companies going by algorithms. There was a big controversy. My audience knows I'm the editor of Real Clear Health, and we linked to this. United Healthcare denying care not based on the substance of the issue, but on algorithms.
AI.
Oh, we got it wrong.
Right.
Well, if you get it wrong, and a patient can't get the procedure or the operation or the hospital stay, maybe you can fix it in a week or 2 or 3, but maybe the patient doesn't have a week or 2 or 3, and we have to fix this also. I'm not sure the answer to this, and I know that McUlsky Health Force doesn't deal in that side of things, but you see the impact.
We do a lot with the National Health Council, if you
Yes.
don't know, an umbrella group that represents, as they say, where the health community meets.
Yes.
And
we need those places.
Very much so. And that's where they talk a lot about access issues and what the challenges are and the walls that are put up for patients. You talk about when their oncology meds, and that need to be gotten, for the patient to be able to, before they're, and it's not just oncology, there are a lot of other things that you can't roll it back if you've deteriorated to the point.
Yeah, I got to be careful with anecdotes, but I'm on some medicine, and I ran out of something I have to take after a procedure that I had. And I called my pharmacist, and he said, well, we'll fill it for you on Monday, yesterday. And I said, well, I'm out today. I can't go 3 days or 4 days without it. And he said, well, your insurance company won't allow for it unless you just, and he told me what I would pay versus if I just waited till Monday. So I didn't take my medicine for 3 days, and maybe that was a timing issue. I don't know. But it seems to me, and the right and the left, we're in DC, so politics is very prevalent in our lives. Yes. But it doesn't make, I have never met a Republican or a Democrat, a conservative hawk or a Medicare for all progressive who disagree with the idea that we should have universal access to care.
Yes.
Which means medicine.
Yes.
And I would make the argument that sometimes access to medicine helps the systems because you don't have long hospital stays. You don't have heart procedures and this sort of thing. We need a shakeup, a reset of the values in how we deal with the healthcare.
I read this morning a LinkedIn post that a good friend, dear friend, Carl Schmidt posted. Did you? I don't know.
I know Carl.
Right.
Tell us about his affiliation.
Right. So Carl posted that in the president's budget on Friday, he cut the prevention aspects of some of the AIDS programs.
So Carl's what organization?
HIV Hep C Institute.
Patient organization.
Patient organization representing those with HIV and Hep C.
And I know Carl. Carl isn't a Trump hater, anti-GOP guy.
Carl was the chairman of the HIV task force under Trump 1.
Okay, well, and that's my point. My point is, we could be critical.
He's not a hater.
Right, but my point is, we could be critical of the budget, of proposals, of where NIH is going. And it doesn't mean we are against Dr. Jay Bhattacharya from NIH.
Right.
We could be concerned about what's happening at FDA and not be against Dr. McCary, Marty McCary's ethos, what he's trying to do at FDA. I think there's, again, you talked earlier about patient organizations sometimes being worried about the media. I think a lot of us who are involved in advocacy, because I do advocacy, I write and that sort of thing, we're concerned about, I don't want to upset that chairman of that committee, or I don't want to upset this person in the administration. And we ought to encourage, let's do this here. Encourage a more free flow of information and criticism. I'm a father, you're a mom, I have 5 kids. They get a lot of criticism from me, but it's constructive and it's meant to make them better. And I'm sure that's Carl's point.
Right. That's right. And I would also say economically, it was a really strong position he was putting out there, because if you prevent the HIV or the Hep C, guess what? You save a lot more money than what you have to do to treat it later. Which
goes to, I know, an area that McUlsky Health Force has been extraordinarily active in, which is the vaccines and more recently, pneumonia vaccines.
Yes.
I know that, was it a year plus ago, ACIP?
Yes.
ACIP.
A year ago, October.
Gave a recommendation, which is important. ACIP is the advisory council. Help me out.
Immunization practices.
Essentially, it's the science committee that
under
helps,
CDC.
Yeah, helps advise vaccine policy.
Yes.
And they recommended, to their credit, not 1 but 2 new medicines, vaccines for pneumonia.
Yes.
And again, in my mind, I spoke a lot about this at the time. I thought this ACIP CDC was putting science back on the map again after a couple of years of politicizing COVID and voices back and forth in debate. Well, this was science.
Yes.
This was the best medicine, preventive medicine. Oh, and that was our message in terms of at Real Clear Health, but I know your message was access, right? But also makes economic sense.
Yes.
If you take a vaccine, guess what? We're not going to be out of work for 3 or 4 weeks. You're not going to overload other work. It just makes sense.
Yes.
Your doctor, yourself, and whether or not to take this medicine. And I know you did, and I think I interviewed John Stanford. You introduced me to John Stanford from
the Black Chamber.
Yeah,
and the PRISM group.
And the PRISM group, yeah. And he made the point how small businesses, vaccines are critical to the health of small business in this country.
Right.
To my friends out there who don't understand this, you can't run a small business of 15 people when nine of them are out because they're sick. So vaccines, medicines, access to care is so important.
I mean, you look at measles. I mean, what are the, that's just, sorry, that's nuts. I'm sorry, it's my personal view.
The fact that we're having a resurgence of measles is nuts.
Yeah.
It's funny. I saw a old Brady Bunch show where all the kids got the measles, and it was almost it was almost nonchalant, but it could be because we had solved measles.
Yeah.
And so, but now measles is it's like
how many children have died?
Yeah, I mean, I want to say more than 1,000, but I'm not.
No, they've been diagnosed with
over
measles.
Over
1,000, and the number have died. And the question is, there's even a challenge of whether it's actually a lot more than that.
Yeah. So there is a hesitancy on vaccines right now.
Yes.
And there's lots of causes for it. My message on the Business of America podcast, you've heard me say this, and that is, we got to get past it.
Jerry,
we got to put science ahead of politics.
I remember, because I'm old. I remember my brother getting measles because it was before the vaccine, and I remember my mom didn't go to work because she was there. All the drapes were closed. He couldn't deal with light. There's lots of, there's lots of issues that happen with that. And I'm not saying everybody should be forced to do it, because some people can, some people can't. But you should have the ability. I mean, the COVID vaccine, if you want your child to get a COVID vaccine, your insurance company should pay for it. And ACIP should say it's available, not mandated. But available to be able to have those kids to have it. So
imagine a world where patients and doctors and insurance companies and pharma companies do what's best for the best universal care, the best access to care, the best care for patients.
It's for patients, and it's actually for the whole healthcare system.
Sure.
I mean, I really believe that. And when you have people,
we're in the middle of this Medicaid fight, talking about Medicaid numbers, and Medicaid is $900 billion, and it's growing faster than the economy. But there are people who need Medicaid.
Yes.
And so what do? We have to look for savings, and one way to save money, vaccines. One way to save, and I don't mean to sound cold about that. It's also good for patients, vaccines, but it saves the system's money. If we want, again, for my fiscal hawk friends, if we want to bring spending down, overall spending down, we have to. It's counterintuitive. We have to increase access.
Yes.
Right.
Yes.
More access will eventually lead to, and we know this because we've seen it happen before. Right. Preventative care, where we've had these experiments and companies have tried. Well, let's try eating right and being on our and being on our meds, and wow, our health care bill came down.
Yep.
Right?
Yep.
So more access, greater access can lead to and should lead to spending less.
Absolutely. Prevention is vital for us to be out there. It's like
I feel like we're saying the obvious, and
I know,
but it's not obvious, is it?
No, I think there are a lot of people that still struggle with it and try to figure out how it works, what it means. And so, I mean, I just think we need to get together as a community and do what's right. And again, not only for patients, in large part for patients, but also for the healthcare system at large. Yeah. It's just vital.
And McUlsky Health Force is right in the middle of all this.
We try.
Kind of. Again, I when I was a kid, kids don't ride bikes like they used to. But when I was a kid, my mom didn't call me on this to find out where I was. She literally drove through the neighborhood and found out where all the bikes were.
Right.
There's Jerry. Anyway, I think of McUlsky Health Force as a bicycle wheel with all these kind of spokes coming out of it, patient organizations, access to care, vaccines, veterans groups, the Grange, rural groups, policymakers. Tell us a little bit about how I know that you've, in D.C., you've started a conversation series of bringing in diversity of voices, including some folks from the Hill, if you want to talk about it. But
I'm happy
I think
to.
conversations matter.
I agree.
And you've been very innovative in bringing in diverse voices to talk about health policy.
So I was in a meeting Jerry was there, and one of my colleagues from McUlsky Health Force was there complaining about the lack of understanding from some of the conservative think tanks on a particular policy issue. And Jerry rightly said, have you told them why you're concerned about this? And she kind of stopped and said, well, no. Well, how do you expect them to understand what the implications are to the patient community if you haven't told them? And that was the kernel of the idea that Jerry and I took and moved forward and said, let's just do this ourselves. Let's begin to bring those. We know the pharmaceutical companies. We know the patient groups. Jerry knows the conservative think tanks. How do we bring them together? So we do a monthly happy hour. We decided that it needed a little libation to be able to help people relax a little and be straightforward with each other and talk about.
And there's been some fireworks.
There has been.
but civility.
And very much so.
And again, I'm a believer. I've always been a believer in the personal. It is very difficult to make someone the boogeyman or to be unfair with someone when you've met them and talked with them, shared a drink with them or a cup of coffee or a meal.
You realize they're human and they do care. They may not understand all your points of view, but they are human and care. I still laugh. Jerry, I don't know if you remember seeing this the other night. This is probably last month or so when Sally Greenberg, who's the CEO of National Consumers League.
Love Sally.
Sally definitely is to the left on the spectrum. And she comes up to me and she whispers to me after the conversation was over and said, Grover Norquist is here, Janet. I said, yes, I know.
Sally and Grover in the same room. But that's what we should do.
And Sally wanted a picture with Grover and said, do you think he'd mind? I said, I don't think so at all. Go ask him if he'll do it. So he was as gracious as he could be and said, of course. And so it was a real epiphany because you sat there and said, we just need to talk more.
Yeah.
I think there was...
And we might disagree.
Right.
And, we don't use this term often, but I had a mentor, Fred Smith, not the FedEx Fred Smith, although he would have been a great mentor. I would love that guy. But Fred Smith is the founder, was the founder of the Competitive Enterprise Institute. His wife, Fran Smith, ran Consumer Alert for many, many years. And Fred said to me, because we did a lot of work, I worked at CEI, and we worked with Ralph Nader all the time. And Ralph Nader is as far left as you can get.
Yes.
And Fred was not. Fred was libertarian and everything, down with the state kind of a ethos. But there were issues where they worked together and they trusted each other and there was goodwill. And to me, that was how I was raised politically. It was to find, Reagan would say, if there's, we don't have to agree on everything, but 7 or 8 issues, we'll work together. The heck with 7 or 8 issues. Give me one issue.
Yes.
Give me one issue where we can work together to make the life better for patients and to advance innovation, medical progress. I'll work with anyone on that one issue, but then expect a good fight from me on those other issues. And
where I disagree.
That should be what we do here.
Right. And you said it, we were on a call Friday, Jerry, where we were talking about some of the cuts that are being discussed. And you said, about SNAP. It's a real issue for so many of our seniors that need those nutrition programs.
SNAP is one of the most successful government welfare programs in the history of government welfare programs. And I am very critical of welfare programs and or many aspects of it. But SNAP to me is, and maybe this is how we grew up. I grew up, my father worked for the New York City Transit Authority, and my mom worked in a bank. And then she had children, and she stayed home, but she worked Tupperware. She babysat. She did laundry. I mean, my mom made a buck, but also was with us. And in my mind, kind of that working class, ethos. That's the 4th time I think I used that word in this interview, but ethos. And SNAP is for men and women like my parents who. What if my dad got laid off? What if there was a strike? My dad went on strike a couple of times when I was a kid. SNAP would pick up pick us up and allow my mom to go out and get the food and that sort of thing. And also for my friends, I don't want the government coming in and monitoring what poor people eat. Well, they shouldn't have sugar and they shouldn't have chocolate. Well, I mean, if you're going to start monitoring that for the poor, and we're off topic here, but I'll just say this. If you're going to start monitoring what the poor eat, what recipients of SNAP eat, insurance companies are going to say, you know what? I'm curious. Jerry's obese and his blood pressure's through the roof. I think we should monitor what he eats. And we should use that in terms of whether or not we're going to allow for coverage. That's dangerous. That's dangerous space there.
Yes.
Which brings us back to healthcare. See how I brought us back to healthcare?
I think you're right. And I think that's part of what McUlsky Health Force is trying to do, is to really encourage these conversations, because I do think that's healthcare. I mean, SNAP, nutrition, what you're eating, how you're eating, is about having good health. And so we talk about it, whether it's for seniors or for children or for chronically ill patients. We need to be worried about all of it, which is, again, I would say that's what National Health Council does, is they bring them all together.
You keep good company.
I try.
You know, Carl Schmidt, Sally, the National Health Council, yours truly.
Yes.
We're coming to the end, but
Okay.
but a couple of things I want to ask you about in terms of what you do. Insurance companies. How can we talk better? Maybe we should invite some of them to the happy hour, and so maybe it is conversations. But what haven't we discussed yet that we ought to make mention before we close out?
I think we're in a good place. I mean, I just think, you mentioned it early. We are a women-owned company
Which is awesome, by the way.
Which is almost all women.
I know.
Jerry drops in periodically as our token.
But it's funny because, again, with all the arguments over diversity and equity and this sort of thing, I think it's kind of neat, this band of women who it's true, right? This band of women who have more than survived, have had a positive impact on health policy, and they're still going.
Yes.
And I know you a little bit. I know that you're still thinking about innovative ways to continue.
Well, I think we just want to get the patient's voice out there more and more, not only for the patients, but for the healthcare system, the drug companies, the insurance companies. I think if they could look more than a quarter to quarter, I think they would see that, good health treatment is going to be vital.
Yeah. One last question.
Yes.
And this might outside of MMA, this might be the provocative thing. Pharmaceutical companies get lots of criticism. We talked about that already. Unfortunately, I think some patient organizations are also getting unfairly criticized about being the mouthpiece for industry. And I know these groups. I know them through you, but I've known them because I've worked with them. I've partnered with them at Real Clear Health for 2 decades.
Yes.
And again, these are heroes. These are men and women who have rolled their sleeves up, who could have done other. I mean, talk about not getting the shore house or not getting the yacht or whatever, because they've decided, no, I'm going to work here and do this now. Talk about that a little bit, and how about that they aren't. It's my show. I can say this. I'm my thumb on the scale. They're not the mouthpiece for industry.
No.
And how do we better communicate that?
Well, I would say the vast majority of people that work for nonprofits, whether it's consumer groups, rural groups, patient groups, do it because they have a personal passion. They had a loved one that suffered, and I won't name names because it's private for them, but if you know them and talk to them, they will explain why they're there, taking half of the salary that they could be making if they were in the corporate world. They are very clear in their mission to make better care for the communities that they represent. Yeah. And it's really outrageous when people try to discredit them.
Yeah. I think, unfortunately, in politics today, we don't argue the merits. Everything is attack.
Yes.
And I remember years ago I worked for the Competitive Enterprise Institute, and we were putting together a book. It was chapters written by scholars from all over the United States, and it was on energy policy. And the New York Times called Fred Smith and asked about the book and this sort of thing. And I was the director of development. I was the fundraiser, and the fundraising question came up. And Jerry, so and so from the New York Times wants to talk to you about how we're paying for the book. I'm like, all right. And he kind of barked at me. You're getting money from the big oil and gas industry, and that's why you're doing this book. And I said, whoa. I said, wait a second. I said, tell you what. I said, why don't you write down all the companies you think we're getting funding from? Because we're not. And I'll go out and raise money because they should. Yes. And then you can come back and talk to me again. Again, I don't like this assumption, and the left and the right does it, that you're only doing this because you're being paid to do it. And that's nonsense. Money follows the ideas, right? So there's a reason why Pharma supports patient organizations, because patient organizations are doing the work of the patients that Pharma cares about. It just makes sense. And this idea of criticizing or dismissing, even worse than criticizing, dismissing an argument because they are aligned with or have resources from. This is another reason why I don't like when the right says, oh, he's a Soros-funded guy. Well, maybe Soros is funding him because Soros agrees with what he's saying.
Yes.
Right?
Right.
Why do you make investments in the stock market? Because you have an interest there and you think it's going to.
Yes.
And again, so this idea of being hypercritical, I hope that we can begin. I think McUlsky Health Force is doing this. I hope others would catch on that we should have conversations, we should have arguments, and then we should move on and get to the next thing and make life better. So. I'll give you the last word.
No, I appreciate it. And I think that's really true. We're here for the patients.
Yeah.
That's what we need to do. We need to make sure that they're getting the care they need. And whether it's pharmaceuticals or medical treatments or whatever, that's what our gold star, our North Star needs to be, is making sure patients are getting good care. So thank you very much for the conversation.
This has been a pleasure. I'm so blessed that I get to talk for a living because I get to talk to people like Janet. This was another episode of the Business of America. I'm Jerry Rogers, in case you forgot. And this is going to be up shortly, and we're going to post it out and promote it out. But find out, go to Transistor or Apple or Spotify, all these places where podcasts are released, and like us and leave a comment on today's conversation. We want to hear back from our audience. So thank you very much, and we'll see you next time.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream